Mr. President, I rise to discuss one of the major crises facing our healthcare system today, and that is that the pharmaceutical industry itself has become a major health hazard to the American people.
Prices are going up outrageously, no justification. So you can walk into a drugstore tomorrow and find that the price that you're paying for the same medicine you've had for 20 years has been doubled. And you ask the pharmacist why. There's no reason. They can double it based on market needs. So what you have is an incredibly powerful industry charging any price they want. And the result of that is that 1 out of 5 Americans can't afford the medicine that they need. Can you imagine that? So they go to the doctor writes a prescription, but they can't afford to fill it. But 5 major companies made $50 billion in profits last year. So you have an insane situation in which people are dying because they can't afford the medicine they need or getting much sicker than they should just so these companies can make outrageous profits.
We are here with the CEO that is no doubt the center of a national firestorm. I think that's fair to say. Heather Bresch, CEO of Mylan Labs. The price hike has been labeled outrageous by Hillary Clinton, egregious by Bernie Sanders, greedy by the White House. And parents all over the country are outraged that they've got to pay more for their EpiPen. How do you respond to all that?
As a mother, I can assure you the last thing that we would ever want is no one to have their EpiPen due to price.
The cost is more prohibitive than people realize. 2 kids, $600 for 1 set, and I need multiple sets. The school that they go to, they have to have a set for themselves, a set for the nurse, and a set for the trainer if they go out for any sports. And we also have to have a set for our house. So the cost is insane.
The American Medical Association has said this is basically the same product it was in 2009, and yet have raised the price 17 times.
If you follow the money, the reason for these price hikes comes into sharp focus.
What was your salary last year?
About $18 million.
About $18 million. Sounds like you're doing pretty well on this.
When Mylan acquired EpiPen in 2007, Heather Bresch's salary was $2.4 million. As the price of EpiPen swelled, so did her salary, all the way to $18.9 million.
Heather, you understand the headlines, right? Which is EpiPens, which are needed by millions of children. The price goes from $50 10 years ago to $500 or $600 today, and you're making $18 million a year. You understand how that looks.
Brian, look, I understand better than anyone that facts are inconvenient to headlines. We have given out 700,000 free EpiPens. We stock 65,000 public schools in this country with free EpiPens to ensure that they're there when needed.
Heather Bresch has been vocal about Mylan's free and discounted EpiPens, but those who are listening closely can hear the canary in the coal mine.
So I'm holding here a certification form where Mylan has actually said that the school hereby certify that it will not in the next 12 months purchase any products that are competitive to EpiPen auto-injectors. So you actually put into practice forcing schools, and you're so concerned about these kids, to raise the price to $600. If you want it for the $100 price that it used to be at, you need to sign this and say that you can't buy this from anybody else. Don't answer, I'm not asking you a question. That's what you've done here.